السلام عليكم ورحمة الله. إن شاء الله راح نشرح عن موضوع the uses of platelet-rich plasma in oral and maxillofacial surgery. First of all, the concept is about or is concerning about using plasma from your own blood for better prognosis to your surgery, whatever the surgery you have done. The outlines I am going to talk about is blood and platelet-rich plasma, its procedure and its application in extraction socket, and its effect on dental implant. I am going to ask, what do you know about your blood? You have about 4 to 6 liters of blood, which is a liquid connective tissue like other connective tissue in the body, containing extracellular matrix made up of solids and liquid, and about half of blood is plasma. يعني تقريبا 55% of the whole blood volume is a plasma, which is light yellow liquid, contain protein. And the rest of blood content, what we called the formed element, تكون تقريبا 45% of the whole blood volume. The three main classes of the formed element are from the bottom of the tube to the top. راح تكون الإريثروسايت, platelet and leukocyte. هاي الثلاث إليمنت راح تكون لي تقريبا 45% من مكونات الدم، و55% حتكون هي البلازما اللي أنا راح أخذ من عندها البليتلت. What is a platelet-rich plasma? It is the platelet-rich plasma, it is a biological product defined as a portion of a plasma fraction that contain of autologous blood طبعا, that contain blood platelet concentration above the baseline. Above the baseline meaning تقريبا 2 to 7-fold of platelet concentration that يعني مقارنة بتركيز البليتلت اللي موجود بالدم. First described the PRP term by a hematologist in 1970s was to treat patients with thrombocytopenia. 10 years later, PRP started to be used in the field of maxillofacial surgery, then in the field of dermatology for treatment of scar or alopecia, skin rejuvenating, etc. It has an important growth factor, 7 fundamental growth factors, and we can use it in a gel formulation or in a liquid. Gel formulation by adding collagen, thrombin, or calcium chloride, and activating it by adding calcium chloride for better releasing of growth factors. About the preparation procedure, Number 1, the blood sample is drawn into tube with anticoagulation factor, ACD anticoagulant. Each proper PRP device must use a double centrifugation technique. The first spin will separate the red blood cell from the plasma. The second spin finally separates the platelet concentrate اللي هي PRP, حيفصل لنا إياها عن platelet poor plasma. As I mentioned above, إنه for activation of PRP, I can mix it with calcium chloride. Its application in dental surgery, number 1, راح يكون بالextraction socket. The clinical outcomes of PRP in extraction socket. It can promote hemostasis and the healing of the extraction socket. This is a picture of, on the left, the extraction socket without PRP after 10 to 12 weeks, and on the right, extraction socket and a PRP treated group after 10 to 12 weeks. Minimizing post-operative complication and stimulating hard and soft tissue regeneration. Radiographic analysis revealed early and significant increase in radiographic density over baseline measurement following tooth removal in PRP treated patient. لاحظوا إنه الدنسity زادت لما عالجنا البيشنت with PRP. Now about its application or its effect on dental implant. Promote healing of endoosseous implant and bone grafts and strengthening the bone to implant contact area. It permits tissue wound to heal faster and more efficiently. That because it possesses 7 fundamental protein growth factors that they are anti-inflammatory and pro-regenerative, stimulate cell proliferation and angiogenesis properties of these growth factors. This is the application of PRP for dental implant as a liquid for coating material. PRP has been suggested to enhance the osseointegration of implant as activated platelet can release autogenous growth factors into the wound healing site. The goal of platelet-rich plasma is to achieve secondary stability, the secondary stability which isn't under the control of the clinician, and it can be achieved by using PRP لأنه هي راح تسرع من الأوسيو integration process. And thank you.